Hey there, my name is Dr. Casey Peevler, and I am a part owner of one of the local Topeka Homes Pluses called Providence Homes Plus. And we are a family owned and locally owned business in Topeka, Kansas. And my job today and my goal today is to help you understand how to navigate the healthcare system for possibly yourself or possibly someone you love. So I'm going to start out by talking about independent living facilities. And independent living facilities are a type of living facility where you still have a great deal of autonomy over your life. You generally will have your own either house or apartment, sometimes condos, and you will have access to certain amenities that maybe a general apartment complex or condo association would not have. That would be such as food, dining, entertainment, etc., and even access to medical care. And this would be for seniors who are still fairly high functioning, who can walk and perform errands and take care of themselves for the most part. They don't really need any or very little help at home, especially in terms of a medical context. Within the Topeka area, I have looked at the map here, and in each one of these dots or in each one of these pins on Google is an independent living facility. And these are some of the names: Brookdale, Martin Creek, Topeka Presbyterian Manor. There are several in the Topeka market, and a lot of times these facilities will also have other levels of care associated with them. The next level of care would be something called an assisted living facility. And this is for folks who need extra help. They need maybe help with their activities of daily living, ADLs. They may need help with cleaning the house or meal prep or help with taking of medications. They get extra services that help with their level of function. And the types of folks who can, live at these type of places seems to be quite variable. And from what I can understand, talking to some of the folks in the field, is that it used to be that this was considered the next level of care after independent living, but it was not quite the level of a nursing home or a Homes Plus like we own and operate. It is a lower level of care. And a lot of times they'll charge you based off of the needs of the particular resident. They'll have what they call a level of care or a fee schedule depending on how much need the actual person who's moving in has. But my understanding is that as times have changed, they are trying to keep people, hopefully safely, into these places for a longer period of time, to where maybe 15 years ago they would have ended up in a nursing home. Now they're still staying in assisted living, but they're paying a higher level of care and they're getting that level of care at the assisted living. And this is some of the names: Lexington Park. I'm sure you've seen some of these names if you live in the Topeka area. Lexington Park, Rolling Hills, Tanglewood, Legends. And again, like I said, some of these places like Presbyterian Manor, Brookdale, we saw this during the independent living. So a lot of these places will have both an independent side and an assisted side. And then some of the bigger places will even have a long-term care side, which is also known as a nursing home. So before I digress into the nursing home and the Home Plus aspect of it, I wanted to talk about some other common names. So one of the things that I wanted to go over was inpatient medical care. And that would be, God forbid, you or a loved one has some acute medical condition. Maybe you fell and broke your hip. Maybe you have a UTI. Maybe you have some acute medical problem that will require you to go to an emergency room and then have an emergency room and a hospitalist like myself admit you to the hospital and deal with that acute issue. That could be fluids, that could be antibiotics, that could be something that we do in the hospital. And then once you get out of the hospital, if you're not going to be able to go straight home, then you could go to one of generally two places. The higher level of care would be something called an acute rehab facility, or ARF. Now, these are programs that are designed to have at least 3 hours of fairly intensive therapy per day. And it's going to be for your higher functioning folks, people who are, let's say, perhaps status post fall or some debilitating illness, acute illness that they were in a hospital for, and they require intensive rehab, but they have the capacity to do intensive rehab. Again, they're going to be doing 3 hours a day. It's going to be essentially like being in a hospital. You're going to have doctors who are rounding on the patients. Generally, what they call a PMNR or a rehab doc will be following them as the attending physician. And then they'll have nursing staff, PT, OT, as well as other support services to help get them through. They're generally there for a shorter period of time. And then sometimes in these kind of places, they'll also have subspecialists round on the patients who are in these kind of facilities. Cardiologists, gastroenterologists, sometimes neurosurgeons, sometimes orthopedic surgeons will round on these folks while they're in the inpatient rehab facility. They'll consult. For example, I'm a hospitalist. Sometimes the IPR folks will actually consult us as a medical consultant. And then sometimes they have to go back to the hospital. They'll actually ask us to readmit the patient from those facilities. But in general, you're going to be getting the level of care that you would be getting pretty much in a hospital. And again, intensive rehab. In Topeka, we basically have two major acute rehabs. We have Kansas Rehab, which is the major one. And then one of the other, Topeka Rehab, also has their own acute side. The other name you may have heard is called a skilled nursing facility, or a SNF. And that is essentially a step down from an acute care facility, such as a hospital. We call it a post-acute care facility. And these are people who need rehab, who need potentially nursing care. So an example would be, let's say someone comes in and they have been found to have an infection in let's say their spine or their foot, and they're going to need, infectious disease sees the patient while they're in the hospital, and they get told they need 6 weeks of IV antibiotics. Well, sometimes depending on the antibiotics they're going to be giving the patient, it could be several times per day, and that's not feasible for home. So they may require to be in a skilled nursing facility just for antibiotic therapy. Or in probably more likely scenarios, they're going to be needing a combination of nursing care, skilled nursing care, as well as they're going to be getting PT and OT. It's just not going to be as intense as an acute rehab. Generally, they're going to be getting about an hour per day of care for rehab. So it's for people who maybe need the rehab. They need more help than just going home with rehab. But at the same time, they're going to be getting the skilled care. Similar to being in a hospital, generally you're not going to be rounded on by the attending physician as often in a skilled nursing facility, so it's not quite as intense as being in a rehab or an acute hospital like St. Francis or Stormont Vale, but it's going to be still higher than being home. And then one thing I did not cover here in these slides is just home with home healthcare, home PT. In general, these are for extremely high functioning people because you're going to be getting very infrequent stops by the nurse, and you're also going to be getting usually only like 2 to 3 hours per week therapy. So it's going to be people who just need like little extra help at home. They're not going to be people who need intensive rehab. That's not going to be a good setting for those folks leaving the hospital. It could be for people who just maybe they had a bad experience in rehab or a bad experience at a skilled nursing facility, and they're like, I am absolutely not going back to those kind of places. I had a horrible experience and I know I need more rehab, but I can't go back. So I'm going to do the best I can at home. It's not generally a good plan, but it's understandable because there's a lot of variability in the skilled nursing facilities and rehab facilities that you are going to be going to post-discharge from a hospital. So the other very infrequent discharge plan from a hospital is called an LTAC, or a long-term acute care facility. These are for extremely high nursing need patients or very sick patients. These people could be on a ventilator. They could be almost like an ICU patient outside the hospital. And this is going to be a true hospital. This is going to be a long-term hospital, not an acute hospital. It's going to be people who are trached, people who have a tracheostomy tube, people who have a PEG tube, people who are requiring a lot of nursing care, who maybe are bedbound. They cannot get up on their own. It's going to be people who are quite sick. We don't have any of those in the Topeka area. Those would be like the select specialty hospitals. There's a couple in Kansas City. There's one in Wichita, and then there's Kindred Hospital. There's one in Kansas City, for example. And these are chains. We have select specialty hospitals and Kindreds kind of all over the country. Sometimes there's kind of locally owned LTACs, but those are the big names in the space. It's unlikely your loved one or you are going to be discharged to an LTAC, but if you do, that would be a completely separate situation, and you may have to go out of your local area, if you're not in a big metropolitan area, to seek discharge and admission to a place like that. So, which leaves me with what I would consider long-term care options. And long-term care is also known as a nursing home. A nursing home is where you need really kind of around-the-clock help 24/7. They generally are very big facilities. In most cases, these nursing homes, they generally have, hundreds of residents who live there, and they have a variety of levels of care. They may have a memory unit, which is locked. They may have, lesser levels of care where people get, either share or have their own private rooms. And they are getting everything from showering to bathing to house cleaning to medication assistance, etc. They are going to have a higher level of nursing need, and these places are generally more expensive. One thing I didn't mention was that generally, as long as you're insured, your inpatient hospitalization will be covered by your insurance company. Skilled nursing, acute rehab, and even LTAC care can be covered by your respective insurance. But the long-term care the assisted livings, the independent livings, the nursing homes. And lastly, what I've not touched on is the Homes Plus model, which is a newer model. Those are not covered generally by insurance. Now, it gets a little bit more nuanced than that because after a certain point in time, if you have no assets, then sometimes you can get onto state Medicaid insurance, which can cover a portion, if not all, of some of the facility costs. But in general, these are going to be private pay facilities. And I did want to highlight Home Plus just because that's the business that we're in. Home Plus is essentially the same level of nursing care than you would get at a nursing home. Only the major difference is that you're going to be in a residential home. You're not going to be in a big giant facility. We have in our facility, for example, we have 2 CNA or CMAs, which stands for Certified Nursing Assistant or Certified Medication Assistant, on staff 24/7 for a maximum of 10 residents. Whereas, unfortunately, one of the big downsides of the bigger facilities is that you may have one CNA or CMA for 30 to 50 residents. So you're going to get much more individualized care, a much more kind of home-like setting. You're going to be getting, I don't know if I can speak for all the Homes Pluses, but for example, at our Homes Plus, we, pretty much will cook to whatever the resident likes. We don't have set menus, although we do have, a proposed menu. And then if they want something else, we will generally cook it for them. But it's definitely a more tranquil, home-like, relaxed, and personalized environment, but still providing that 24/7 level care with showering, bathing, dressing, feeding, medications, etc. And we have a nurse that's on call and in-house most of the day, but they're on call at least 24/7. So we basically are going to be acting as a long-term or nursing facility without being in a big facility. One big thing that I wanted to mention and hammer home is that unfortunately in a lot of the bigger facilities, the assisted living facilities and the nursing homes, is that if you decide to come as a couple, for example, you and your wife or you and your husband need to come to a long-term care facility, a lot of times the families are broken up by the facilities, not out of malice, but because maybe the wife is a higher level of care or a lower level of care. So she's going to be over in the assisted living or the independent living. And then the husband is a higher or lower level of care. So he may be in the nursing home and maybe in the memory unit. So that's it's hard for them to keep them together, which is, I think, very sad. It's understandable, but it's also sad. And so one of the big pluses that we have in our Home Plus model is that we can keep families together. We can keep them in the same room or at minimum in the same house, and they can see each other, interact with each other, and still, maintain a relationship as their years go on. So trying to think if I've missed anything. And then, when you cross the Rubicon to become, let's say you're closer to the end of life and you're in like more of a hospice setting, we have hospice that comes into our facilities. We also have home health. We have home PT and OT if you were admitted to the hospital, recently discharged. So we have all those things, just like a nursing home. A nursing home will also have hospice come in. They'll have skilled nursing and PT and OT that comes in if it's warranted for a post-hospitalization type situation. So in terms of care, they're technically equivalent, although we do believe that the Home Plus is a superior model, but it's not for everybody. Some people prefer the bigger facilities and some people prefer a smaller, kind of more intimate home-like setting, but it just depends on what you're looking for yourself or for your loved one. So I hope this was helpful in helping navigate the very confusing and kind of ever-changing hospital and medical system. And if you have any questions, just post them and I'll try to get back to you and comment. And if there's any way we can help you find a safe place for your loved one or yourself, we would love to help with that. All you have to do is just call our number at Providence Homes Plus, and we can schedule a time for a nursing assessment to help you understand really what level of care is most appropriate and safe for the person who is needing care.